Hi everyone, this is Renee, and in this voiceover we're going to discuss soft tissue and sports-related injuries. We're going to start with a strains and sprains overview. So strains and sprains typically happen during sporting events in people of all ages, and it's very important to know that sprains and strains can happen anywhere in any accident. Ankle strains are the most common and frequently occurring orthopedic injury. In fact, they're responsible for 40% of all athletic injuries. The next most common injury is the anterior cruciate ligament tear, most commonly referred to as an ACL tear. It is a severe and painful sprain, and it occurs near the knee and typically happens in sports that involve twisting and jumping, such as baseball, football, or gymnastics. It is more common in women, and this is because of the biomechanical and neuromuscular factors, such as women commonly having knock knee, and they also have less muscle strength compared to men. They also have more flexibility in the knee area. So I want to start by saying that strains and sprains are actually two different injuries. Strains are tearing or stretching of muscle or tendon tissue. Remember that tendons connect muscles to the bone. Strains often result from overexertion, overextension, or overstretching. There are three different categories of a strain. The first being a first degree or a mild strain, and this is when there's minimal or mild inflammation and pain. The symptoms can last for several days, but the range of motion of that extremity is usually not affected. The second is a second degree or moderate strain. This is when you have tearing of the muscle and tendon fiber. The injury is often painful with severe muscle spasms, extensive inflammation, and ecchymosis. And this can last for several days after the injury, and the overall symptoms can last for several weeks. The last one is the third degree, which is the most severe strain. This is a rupture of muscle or tendon, and it causes intense pain, internal bleeding, inflammation, and again, ecchymosis. There may even need to be a surgical repair if there is extensive tearing to a muscle or tendon. So moving on to sprains, they are very similar to strains, except where strains affect the muscle and tendon, sprains actually affect the ligaments. So a sprain is the stretching or tearing of ligaments. Ligaments are segments of connective tissue that secure bone to bone and bone to cartilage. Again, sprains are caused very similarly to strains by overexertion, overextension, and overstretching. Sprains are similarly classified as strains with the 3 degrees. So the first degree sprain or a mild sprain has minimal edema and pain, and the second degree has a moderate amount of tearing to the ligament fibers. The joint is still intact and the ligament is not completely torn. There will be increased swelling, ecchymosis, and pain, and also an altered weight bearing in the affected extremity. The third degree sprain, which is the most severe, has a complete tear of the ligament, and this can make the client unable to ambulate because of joint instability. Some symptoms of the third degree sprain include severe pain, ecchymosis, and edema. So on this slide, this is just a picture that kind of describes visually what we just went over on the previous slide. So you'll see on the left-hand slide where the strain is, there's damage to the muscle or tendon, whereas on the right side, there's damage to the ligaments with the sprain. And you'll see that the ligaments connect the bone to bone. Medical management for strains and sprains. So the first step, again, is diagnosis, which starts with a history and physical examination. Typically, x-rays will be done to rule out any bone fractures, and then an ultrasound is very helpful with confirming, and an MRI will give a definitive diagnosis. The medical management will depend on the degree. The first and second degree strains and sprains are handled with RICE remedy. So R stands for rest, and that's resting the extremity for 3 days. I is for ice, and the ice will be applied for no longer than 30 minutes, 3 to 5 times a day for 2 to 3 days after the injury. The C in RICE stands for compression, and this can be done with an ACE bandage or a pressure dressing, and this minimizes the swelling from the lymphatic system. And it's important to maintain neurovascular function, so make sure that the ACE wrap or pressure dressing isn't too tight. E is for elevate, and we want to elevate the extremity to reduce dependent swelling. In addition to RICE, NSAIDs are also often prescribed or recommended, and this is to decrease pain and the inflammation of that area. For third degree, surgical reattachment may be necessary, and this can happen through sutures or grafts. So there are some complications that can occur with strains and sprains. The first one is chronic instability of that joint, and this typically happens when there is recurring injuries or if the client doesn't maintain RICE. So if they don't follow the directions to rest, ice, elevate, and compress the extremity. So what will happen is there'll be an alteration in mobility and function of the client, and sometimes this can be so severe that they'll have a deficit in self-care. The client will also be at risk for repeated injuries. So that area, and often with a first and second degree sprain or strain, can get re-injured, and it'll be re-injured at a more severe degree, and it may require surgical repair. While it is rare, compartment syndrome is also a potential complication. So remember the 6 P's of the assessment to identify early on if compartment syndrome is present. Nursing management for strains and sprains. Again, we're going to start off with a history and physical, and then we're going to do our physical assessment, paying very close attention again to the 6 P's. There is a picture on the slide, but just remember that pressure is also part of the assessment. Nursing actions are what we talked about before: RICE. We want to rest, ice, compress, and elevate the extremity. Education for the client includes any complications that might be present, focusing on preventing reoccurring injuries, and independence with RICE at home.
Nursing management for strains and sprains. Again, we start off with a history and physical, then do our physical assessment, paying close attention again to the 6 P's. I've included a visual on the right-hand side of your screen, but please remember pressure is also a part of the neurovascular assessment. Nursing interventions include RICE, the rest, ice, compression, and elevation. Education for the client includes any complications that might be present, focusing on preventing reoccurring injuries, and independence with RICE at home.
We're now moving on to dislocation and subluxations. So a subluxation is when a bone partially comes out of socket, where dislocation is when the bone completely comes out of the socket. So both of these are injuries that cause pain, swelling, and weakness at the area. This happens when there is hyperextension or pulling, or varus or valgus stress. There is a link in the slide to give you a better idea of what this is. Just please do not perform this on somebody. For treatment for a dislocation, usually they'll have to go to urgent care or the emergency department for possibly sedation and then relocation of that joint. If there is repeated dislocation or subluxation, surgical repair is often going to be necessary. Prevention of this injury includes physical therapy to strengthen the muscles surrounding that joint, and this is to help prevent any reoccurrence. So on this slide, there's going to be 2 images displaying dislocation. So the one on the left is shoulder dislocation. You can see how the ball of the humerus is completely dislocated from that joint. And on the right-hand side is a picture of nursemaid's elbow. What a horrible name for that. This is the most common dislocation with toddlers, and it's often due to the caregiver picking the child up by the forearm and dislocating that elbow. Okay, now we're on to muscle contusions. So a contusion is the second most common sports-related injury after strains. This injury is associated with pain, swelling, and also restricted movement to the affected area. What happens in the body is a portion of the muscle ruptures, and this causes significant bleeding. And you'll see a hematoma present because of the bleeding underneath the skin. The skin is not ruptured or broken at all. Often you will hear a popping sound of that muscle ripping. Muscle contusions are also staged, just like strains and sprains are. So they go from first, second, and third degree and increase in severity. In first and second degree muscle contusions, the treatment will just be simply, non-weight bearing to the affected extremity to allow itself to repair. In severe third degree contusions, surgical repair may be necessary. Contusions can be prevented by educating clients on proper body mechanics, especially those who play sports, and to have strength training prior to rigorous exercise.
Now on to muscle contusions. A contusion is the second most common sports-related injury right after strains. This injury is associated with pain, swelling, and also restricted movement to the affected area. What happens in the body is a portion of the muscle ruptures, and this causes significant bleeding, and you'll see a hematoma present because of the bleeding underneath the skin. The skin is not ruptured or broken at all. Oftentimes you'll hear a pop sound of that muscle ripping. Muscle contusions are also staged, just like strains and sprains are. They go from first, second, and third degree and increase in severity. In first and second degree muscle contusions, the treatment options will just simply be non-weight bearing of the affected extremity to allow itself to repair. In severe third degree contusions, surgical repair might be necessary. Contusions can be prevented by educating clients on proper body mechanics, especially those in sports, and to have strength training prior to rigorous exercise and training.